Let's start with background information about the client. Gustavo self-identifies as a 12-year-old male who lives at home with his mother, sister, stepfather, and half-brother plus a dog. He gets along with his stepfather and half-brother and is closest to his sister. His strengths include helping out around the house, especially with the foster brother, and being family-oriented. Gustavo's family identifies as Mexican-American from Southern California. He is currently in the 8th grade in a police academy, which mom placed him because of getting into physical fights about 2 years ago. At intake, mom stated symptoms generally include Gustavo crying and screaming in response to being asked to do housework. He often misplaces items and will forget about schoolwork or chores. Important recent behaviors have included an argument with a peer, which led to Gustavo going to the counselor's office and running away from home when arguing with mom about taking care of their dog. Additional important information includes that he didn't have his biological father growing up. Dad went to jail for drug trafficking when Gustavo was a baby and subsequently got deported to Mexico. Gustavo stated he talks on the phone once in a while for birthdays and such. The following roleplay we're about to view will show the use of interpretation into exploration as an intervention for psychodynamic therapy.
So Gustavo, your mom mentioned an incident the other day when you were getting mad about the dog.
Mm-hmm.
Can you tell me more about that?
Sure. I was playing video games and she had told me that I needed to wash my clothes. And I said to her, just wait a minute, just let me finish the video game. And then she goes, no, do it right now. And I said, don't worry, I'll get it done. I always get my things done, right? And she says to me, no, you don't. You don't get your things done. We got this dog and we brought it home for you, and now you don't take care of the dog. I have to take care of the dog. This is one of the things around the house that you don't do. And I said, what are you talking about? I do a lot of things around the house. And so we just went into this argument about what I do and what I don't do, when I know I do a lot of things. And I got upset and I cried and I punched the wall, but I don't know, whatever, man. I don't care.
I've noticed that's a recurrent thought for you, saying that you don't care.
Yeah. I say I don't care.
Well, you've said this before a few times, too. For instance, a few sessions ago, when you were here, if you remember, you said, you were talking about how you were seeing a counselor in your school because of a confrontation you had with this other kid who said things that were very hurtful to you. And you got angry and you got into an exchange with him and you got into trouble, but you also said that you didn't care.
Okay.
Right? So I wonder if that's a form of denial for you. And correct me if I'm wrong, but I wonder if saying that you don't care is not because you actually don't care, but it's because you want to get people off your back. I mean, I get how it could be helpful to you, how it could lift the stress off, or all these that we talked about are stressful emotional situations. By saying you don't care, by telling yourself or others you don't care, you might be kind of pushing those aside. But, if you look at it as a kind of denial, again, I could be wrong, so tell me, but if you look at this as a kind of denial, then it's preventing you from looking at the actual situation. So there's this frustration between you and other people, or other people are trying to help you understand the situation, but you're telling them that you don't care, even though you do, because you were telling me yourself how those situations, either made you cry or made you act out. What do you think?
So looking back on interpretation exploration as an intervention for psychodynamic therapy, there were main pieces the therapist exampled. He identified a pattern of behavior or perspective the client holds about himself or his relationships, which the client might be using to avoid stressful situations. He proposed an explanation of the behavior as a defense mechanism to the client. He encouraged the client to reflect on his thoughts and feelings in reaction to this proposal or idea, and most importantly, he remained collaborative by saying, "Correct me if I'm wrong," which allowed the client to guide or change the interpretation. As part of collaboration, it's also important to take culture into consideration and social injustices. Your interpretation and perspective will never be perfect because our cultures are unique. So we need to remain open to change by the client in our interpretation because culture will always affect our perspective.